Simplified explanation. Gangrenous necrosis is a type of tissue death that usually happens in areas with poor blood flow, like the legs or intestines, especially after long-term, chronic, ischemia. There are two main types. Dry gangrene. Caused by lack of blood supply, ischemia. The tissue becomes dry, shriveled, and dark. Microscopically, it shows coagulative necrosis, tissue structure remains but cells are dead. Wet gangrene. Happens when infection is added to the ischemic tissue. Bacteria break down the tissue, creating pus and swelling. This shows a mix of coagulative and liquefactive necrosis. It looks wet, swollen, and may smell bad due to bacterial breakdown. USMLE Question 1. An 80-year-old man with poorly controlled diabetes has a blackened, dry toe with no signs of infection. What is the most likely type of necrosis present? A. Liquefactive. B. Caseous. C. Fat. D. Gangrenous, dry. E. Fibrinoid. Correct answer, D. Gangrenous, dry. Explanation. Dry gangrene results from chronic ischemia without infection, typically seen in distal limbs. The tissue is dry and dark due to coagulative necrosis. Why not the others? A. Liquefactive necrosis is seen in infections or CNS infarcts. B. Caseous necrosis is associated with TB. C. Fat necrosis affects fat tissue like breast or pancreas. E. Fibrinoid necrosis affects blood vessels. USMLE Question 2. A man with untreated peripheral artery disease develops gangrene in his foot. After a few days, the area becomes swollen, oozing, and foul-smelling. What type of necrosis is most likely occurring now? A. Coagulative. B. Liquefactive. C. Wet gangrene. D. Caseous. E. Fat necrosis. Correct answer, C. Wet gangrene. Explanation. Wet gangrene occurs when an infection develops on top of ischemic tissue, causing liquefactive necrosis mixed with coagulative necrosis. Why not the others? A. Coagulative alone would be seen in dry gangrene. B. Liquefactive is part of wet gangrene, but the term wet gangrene is more accurate. D. Caseous is seen in TB. E. Fat necrosis happens in fat tissue, not the limbs.